I'm Chris McDowell. I'm the program director of the SIU Emergency Medicine Residency program. When I decided to be a chief resident, I recognized that I really enjoyed teaching and saw that I had a chance to have a much bigger impact on both my colleagues and patients. And then my program directors pulled me aside one day and said, Chris, if you're part of the program leadership of a residency program someday, you can impact patients for many, many years all across the country and in regions that you had no idea you could have an impact. And that really resonated with me. And from that point on, I recognized that's what I wanted to do. I think having medical students and residents work with me day to day in the emergency department makes me a better physician. First of all, it reminds me that I've got to be a great role model because I have people looking at my example all the time. Secondly, they challenge me. They ask me questions. Why are we doing it this way? Is this a better option? They make me rethink my medicine, and they make me a more current provider. So I think it's a great opportunity for me to continue to enhance my own skills while I get to teach them at the same time. I think the most important thing that we tried to make priority from the start of our program was the residency culture. We wanted the residents to understand that we're here to take care of patients and to do that in a professional manner. Secondly, the residents understand that as a new program, we need a very high level of engagement from both faculty and residents. And our residents understand that, and they leave this program thus far in a better place than they found it. One of the most exciting developments on the horizon for our residency is the development of the Memorial Center for Learning and Innovation. One of our partner institutions is developing a new center where they will more than double their capacity for simulation and surgical skills. We take advantage of those opportunities now to teach procedural skills, to do simulation training, to enhance our residency education. But our capacity to do that in this new center will be greatly improved. I think it offers us the opportunity to rethink how we use simulation and maybe revolutionize our curriculum even in our short time as a program. We're very fortunate to have two hospital partner institutions, St. John's Hospital and Memorial Medical Center, who work with us and provide our emergency departments to work in. We have excellent facilities at both hospitals, but more importantly, great support. So we're able to provide the learning environment that meets the needs of the residents in a place where they have all the ancillary support they need to take great care of patients. We're blessed with a patient population of over 130,000 patients, so there are more than ample patient opportunities, procedural opportunities for the residents to become competent emergency physicians by the end of their training. We've been very fortunate that there's been a lot of excitement about our program, still being relatively new, and we've seen the number of applicants and the quality of our applicants just continue to improve with each year. And I think that's just a testament to the number of people who are interested in emergency medicine and capable people who want to do this as a profession. The applicants, when they get here, will ask me, what are we looking for in a resident? And it's really pretty simple. We need strong character, we need a great work ethic, and we need a desire on their part to work as a team with the faculty to help get them the best education that we can. And when we have all of those things, I know that we can be successful in educating them. More importantly, when we work together well as a team, we can make the residency program better for the next class that will follow them as well. And I think that is a message that we try to get across each week when we interview new applicants. Our current residents, I think, make the interview process successful. We try to have an evening reception the night prior to our applicant interviews, and it's really the residents who the applicants want to meet. They're polite and come up and talk with me because they have to, but they really want to talk to the residents. What will it be like to live in Springfield, Illinois? Will my significant other be happy here? What do you do when you're not at work? Is the cost of living really as reasonable as I've heard? What are the downsides to the program that I won't hear about tomorrow? I think the residents can provide that information, and I think as an applicant it's critical. Then during the interview day themselves, the applicants join us for an hour of conference, so they're with us in the residency program to see how they learn. The residents eat lunch with them, and then most importantly also provide a tour. The faculty help make this residency go, And their high level of engagement and recognizing what it takes to meet the needs of a residency program is essential to us being successful. But it's really a contract between the faculty and the residents who are going to meet to develop the best educational experience possible. And we've been very fortunate that our residents understand that message and meet us in that contract to make this a successful program. The advent of the new Simulation Center for the Center for Learning and Innovation, I think, will revolutionize our educational opportunities, and it's really an exciting time to be here. I think for an applicant, there's going to be ample opportunity to be a part of that center and perhaps even do some educational development themselves. They may have an interest to be a simulation director somewhere down the line. They're going to get great exposure to simulation in this residency program, be able to provide some of the education behind that, and set the stage for whatever career they want in the future. Our goal is very simple. We want to do three things in this residency program. We want to make great clinical physicians, we want to develop skilled educators, and we want to give people the leadership skills they'll need to be successful throughout their career.